Most men don't realize this, but the prostate is one of the most diet-sensitive organs in the male body. I've been a urologist in the United States for over 2 decades, and I can tell you something very clearly right from the start. Prostate problems rarely begin suddenly. They build slowly, quietly, over years, sometimes decades, and very often food is one of the biggest contributors. Not because men are doing something wrong on purpose, but because no one ever explains which everyday foods quietly irritate the prostate, increase inflammation, and worsen urinary symptoms over time. This conversation is not about fear, guilt, or restriction. It's about awareness. When you understand what stresses the prostate, you gain control, and control is what protects your health as you age. Many of the men I see in my clinic tell me the same thing. They say, "Doctor, I thought this was just aging," or "No one told me food could affect my prostate," or "I've been eating this way my whole life." And that's exactly why this topic matters. The prostate sits at the crossroads of hormones, inflammation, blood flow, and metabolism. Certain foods push that system in the wrong direction day after day. Others support it. Today we're focusing on the foods that consistently cause problems for prostate health, especially after 40, 50, and beyond. You don't need to eliminate everything overnight. Even reducing these foods can make a noticeable difference in urinary comfort, nighttime bathroom trips, pelvic pressure, and long-term prostate health. Let's start with the first food category that causes more prostate irritation than most men realize, and that's heavily processed meats. This includes things like sausages, hot dogs, bacon, deli meats, and packaged lunch meats. These foods are not harmful because of one single ingredient. It's the combination. High saturated fat, preservatives like nitrates, excess sodium, and inflammatory compounds formed during processing all work together to increase systemic inflammation. In the prostate, inflammation matters. Chronic low-grade inflammation is one of the strongest drivers of benign prostate enlargement and worsening urinary symptoms. When men reduce processed meats, many notice less pelvic heaviness and improved urinary flow within weeks, not months. The second food that consistently shows up in prostate research is excessive dairy, particularly full-fat milk, cheese, and cream. This doesn't mean dairy is poison or that every man must avoid it completely. But high intake of dairy has been associated in multiple studies with increased prostate irritation and hormonal signaling that can affect prostate tissue growth. Dairy influences insulin-like growth factors in the body, which can stimulate prostate cell activity. In men already dealing with enlargement or inflammation, this stimulation is not helpful. Moderation matters here. Swapping heavy dairy for plant-based alternatives or reducing portion sizes often leads to noticeable symptom relief. The third food category is refined sugar, and this one surprises a lot of men because it doesn't seem directly connected to the prostate. Sugar drives insulin spikes, and insulin spikes fuel inflammation throughout the body. The prostate is particularly sensitive to this inflammatory environment. Sugary drinks, desserts, pastries, and sweet snacks contribute to metabolic stress that worsens urinary urgency and nighttime urination. I often tell patients that sugar doesn't attack the prostate directly. It weakens the body's ability to keep inflammation under control, and the prostate pays the price. Next is fried food, especially foods fried in unstable vegetable oils. When oils are heated repeatedly, they form oxidized compounds that promote inflammation and oxidative stress. The prostate is vulnerable to oxidative damage, especially with age. Fried foods also tend to be high in salt and unhealthy fats, which further strain blood flow to pelvic tissues. Poor circulation means slower healing and more irritation. Men who cut back on fried foods often notice improved comfort and less pressure in the pelvic area. The fifth food to be cautious with is excessive red meat, particularly when grilled or charred at high temperatures. Cooking meat at very high heat creates compounds that can promote inflammation. Red meat also tends to be high in saturated fat, which affects hormone balance and blood vessel health. This doesn't mean you can never eat steak again. The issue is frequency and portion size. When red meat becomes a daily staple, prostate symptoms tend to worsen over time. Choosing leaner cuts and alternating with fish or plant-based proteins is a prostate-friendly shift. Alcohol is the sixth item on this list, and it deserves careful discussion. Alcohol relaxes muscles temporarily, including the bladder and urinary sphincter, which can worsen urgency and nighttime urination. It also dehydrates the body and irritates the bladder lining, indirectly stressing the prostate. Inflammation increases, sleep quality drops, and hormonal balance is affected. Many men don't realize how strongly alcohol influences their nighttime symptoms until they reduce it. Even cutting back rather than eliminating alcohol completely can lead to better sleep and fewer bathroom trips. The seventh food category is spicy foods, especially for men already experiencing urinary symptoms. Spicy foods don't harm the prostate structurally, but they irritate the bladder and urethra, making prostate-related symptoms feel worse. Burning, urgency, and discomfort can increase after spicy meals. If a man already has prostate enlargement or inflammation, spicy foods can amplify symptoms. Paying attention to how your body responds is key here. Some men tolerate spice well, others don't, and listening to those signals matters. The eighth and final food to watch is excess caffeine, especially from coffee, energy drinks, and strong teas. Caffeine stimulates the bladder and increases urine production. It also tightens pelvic muscles in a way that can worsen urgency and frequency. For men with prostate issues, caffeine often turns mild symptoms into disruptive ones. Reducing caffeine intake, especially later in the day, is one of the simplest changes with the fastest payoff in terms of sleep quality and urinary comfort. Now here's something important I want to emphasize. Avoiding these foods does not mean your diet has to feel restrictive or joyless. In fact, many men feel better overall when they reduce these items. The goal is not perfection. The goal is consistency. Small changes maintained over time are far more powerful than extreme short-term diets. When the prostate is supported instead of constantly irritated, it responds positively. Blood flow improves, inflammation decreases, urinary symptoms become more manageable. I also want to address a common misconception. Many men believe prostate problems are inevitable and untouchable. That is simply not true. While aging plays a role, lifestyle choices influence how severe symptoms become and how early they appear. Diet is one of the most controllable factors. When men take ownership of this area, they often feel empowered rather than restricted. That mindset matters. Another point worth mentioning is timing. Eating heavy, inflammatory foods late at night puts extra stress on the bladder and prostate while you're trying to sleep. Many men notice fewer nighttime awakenings simply by adjusting evening meals. Lighter dinners, less salt, and fewer irritants make a real difference. Sleep quality and prostate health are deeply connected. As a urologist, my approach is always to look at the whole picture. Medication can help, procedures can help, but lifestyle is the foundation. Food choices either support that foundation or weaken it. When men understand this, they stop feeling confused and start feeling confident about their health decisions. If you're watching this and thinking, I eat some of these foods, that's completely normal. This isn't about judgment, it's about awareness. Start with one change, reduce one category, pay attention to how your body responds. Prostate health improves when the body is treated with consistency and respect. In my practice, the men who do best long-term are not the ones who panic. They're the ones who make steady, informed adjustments. They ask better questions, they listen to their bodies, and they stay engaged with their health rather than ignoring symptoms until they become disruptive. Your prostate doesn't need extreme measures. It needs less irritation, better circulation, and a calmer internal environment. Food plays a powerful role in all three. By avoiding or reducing these 8 foods, you're not just protecting your prostate, you're supporting your overall health, your sleep, your energy, and your quality of life. If this information helped you understand your body a little better, that's the goal. Prostate health is not a taboo topic. It's a normal part of male health, and the more openly we talk about it, the better outcomes men have. Stay informed, stay proactive, and remember that small changes today can protect your comfort and confidence for years to come.